When we do the MR scan, we can diagnose your problem and do the proper treatment. Therefore, don't be afraid to go for a MR scan, get the proper advice and get it done as quickly as possible so that we can sort out your neurosurgical problem without delay. In NextGen Neurosurgery, today we will think about a different problem. As we all know, there are many patients coming and telling us they are afraid to go into a MRI scan. So that is due to, some people say it's people may die inside, or they get a serious fear when they are inside, or they think that something can happen to them. But all these thoughts are not correct. Unless the patient is critically ill and cardiovascularly unstable or critically ill patient going into the MRI scan, there are certain steps that we have to take to ensure that these vital functions are maintained during the MRI scan. Otherwise, the patients should not get panic, or it's not a dangerous thing to do a MR scan and nothing will happen to the patients inside the MR scan, such as things like dying or doing some harm to the patient during the process. But there's a condition called claustrophobia, where patients are afraid to be in closed space. In that type of situation, you should discuss that with the MRI department, and one of your family friends or family member can be inside the MRI room, and you can be given some medications or some counseling before the MR scan, and we can do the MR scan without any problem. When we do the MR scan, we can diagnose your problem and do the proper treatment. Therefore, don't be afraid to go for a MR scan, get the proper advice and get it done as quickly as possible so that we can sort out your neurosurgical problem without delay.